the next session, we have 3 speakers who are going to talk about kōrero mai. It means talk to me. The concept is actually remarkably simple, which is asking patients, their family and their whānau to talk to the clinical staff looking after them. It's so obvious it almost defies the need to explain it, but it is a controversial area because it's actually asking people possibly to tell the person who's looking after them and reassuring everything is fine, that actually it isn't, and to empower them to bypass an individual in front of them who at the end of the day is doing their job, but for whatever reason is not escalating care of someone who may be deteriorating. From the program's point of view, we think it's a very important part of what it is that we're doing, and the way we're selling it to clinicians, not that it should need to be sold, but probably will be, is that in my view and in the Commission's view, that the patient's opinion about their current mental state and their physical state is as important as any objective vital sign. And kōrero mai is another vital sign. It's written on the chart that you should escalate care for any patient, family, any patient, let's try and get this right, I'm trying to remember the exact wording. You should escalate care for anyone you or the patient are concerned about. So if the patient's concerned, then that's a prompt for escalation, and for you to think about whether you're actually missing something. We know that people can deteriorate with normal vital signs. We know there's a whole variety of medications we give people that may block their heart rate, for example, that may falsely lower their early warning score when in fact they are deteriorating. And actually asking and listening to patients when they tell you something wrong is very important. Something I'm going to talk about tomorrow, and we have a workshop on this afternoon, which is communication, which is really important and comes down to the centre of most of what we do, is actually not just communicating with, but probably more importantly, listening to our patients. And it's awful to say that we may need a national programme telling us to do just that. Of the 3 work streams, this is one that's been, at least from my perspective, a relatively novel experience, which is to actually do a true co-design process. And again, I defer to my colleague Laura in terms of explaining to me as a doctor what co-design actually is. We have had an expert come and teach us through this, and Lynn has come to many of the workshops that we've held in the DHBs. Co-design, prior to me being schooled by Laura, was basically some doctors and some nurses would sit in a room, they'd write something, and as a token last-minute effort, we'd show it to a patient and say, what do you think of this? And then we'd probably ignore what they said and do it anyway. That's not co-design. That's never been co-design. Co-design is having all the people, all the stakeholders, patients, consumers, their advocates, doctors, nurses, managers in the room at the same time you design the process that you want to build, and not going in with a predetermined solution, which is this is the solution to the problem, let's work out how we get there. And credit to Laura and the team, that's actually what we've been doing, and what all the 3 people who are going to talk to you about are going to talk about their local experience. We know that what may work in Auckland or work in Wellington may not work in Taranaki, may not work in Nelson, may not work in Waitemata. There are lots of different responses to how we do this. So as a team, we've wanted to empower individuals to come to the solution they think works for their DHB and their circumstances. So that aside, enough of me. I'd like to invite the first speaker up. Nadine Spriggs is a clinical nurse educator, and also Kim McFarlane, who's the team leader at Southern Cross Christchurch, to talk to us about their experience of kōrero mai. Thank you.
Tēnā koutou katoa. Ko te kai a te rangatira he kōrero. Ko Kim McFarlane aho, no Otatahi aho.
Ko Nadine Spriggs aho, no Otatahi aho. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Thank you for inviting us today to speak about our work in conjunction with Ko Awatea. We have been privileged enough to have been involved in both Workstream 1 and 2 with Health Quality Safety Commission's Patient Deterioration Programme.
If you have something to tell, ring the bell is actually the underpinning theme of our project, and quite a simple message that we want to promote to all of our consumers in whānau. Our work with Ko Awatea and the Health Quality Safety Commission to identify consumer and whānau escalation pathways has involved a multimodal approach to help us understand the experiences from a consumer and whānau perspective and how they need to escalate concerns. In order to understand these experiences, we have undertaken interviews, observational audits, which have then led on to focus groups. And these have allowed us to explore areas for improvement and enable consumers, whānau, and actually the employees' voices to be heard. There's actually been some difficulty for us to define a specific area to work on. We have a very high patient satisfaction rate, and trying to get some information from our consumers as to how we can improve our service was quite difficult for us.
So during one of our interviews we met Graham, so not his real name. Graham's a 54-year-old male. He's day one post-op following right shoulder surgery. He has no comorbidities and is due for discharge. Kim and I were fortunate enough to be interviewing Graham as part of this project, and as we were saying our goodbyes and thanking Graham for his input, he said, "While you're here, I have pain going down my left arm that's been there since surgery." Alarm bells started ringing. Following clinical review of Graham, we asked, "Would you have rung the bell and discussed it with your nurse?" To which he replied, "No, you nurses are too darn busy." So this obviously raised significant concerns for us, and we decided to make this our focus. The perception of busyness is inherent in healthcare. We wanted to understand why patients perceive nurses to be busy and the implications this has for their care.
So from our data analysis, our consumers actually identified 4 main themes of where the culture of busyness actually comes from. Their previous healthcare experiences within our region was the main driver for the perception that nurses are busy. This resulted in consumers not wanting to ring the bell and actually add to the nurses' workload. Non-verbal and verbal communication was another key theme. Can you imagine walking into a hospital, being greeted by frontline staff who may appear busy, not giving any eye contact, not even a smile, or even ignoring you because they're busy getting on with their work? It can be really unwelcoming, and it actually creates the reluctance for the consumer to seek help. Nurses also bustling about in the wards can appear quite hurried and also highlight a busy environment. The consumers involved in our focus group identified from previous experiences in different healthcare facilities regionally that when they've rung the bell, if there's a delay in the bell being answered or the manner in which the nurses enter the room is actually something that portrays that they're busy as well. Particularly in the last couple of years, and I'm sorry for this, all the nurses in the room, there's been significant attention about, or media attention about nursing shortages and workloads. Our consumers certainly recognise this clearly in our focus groups as having an impact on the culture of nurses being busy. So busyness is very well embedded in society. Consumers and whānau being able to seek help in a timely manner, we actually need to be able to make sure that we provide different tools and which enables them and their whānau to speak up.
Thank you. So the culture of busyness can be minimised with a few key pieces of the puzzle. Our consumers, whānau and employees identify communication and customer service to be of highest importance. Smiling or a lack of smiling was identified a major contributor of people feeling comfortable to seek help. Ongoing education to employees to acknowledge the importance of communication and customer service skills is a continuous improvement and needs to occur in all areas of the hospital. To assist with this, our employee focus group have become champions to support this concept. Our pre-admission service is pivotal for introducing consumers to the initial concept of, if you have something to tell, ring the bell. Our consumers were often confused as to who was who, often mistaking healthcare assistants with registered nurses and also not being able to identify who the charge nurse was to escalate concerns to. A simple solution to this problem we have already begun to address with the change of the charge nurse uniform. We have also implemented the use of the kōrero My Badges, which reinforce what we are communicating to consumers, which is linked to our main piece of the puzzle that we've been working on, which is a display chart.
So as you can see from this slide, we've actually drafted several versions of the display chart, which has actually all been based on consumer whānau and employee feedback. We initially started with some very busy display charts as we felt there was a lot to communicate through to patients and whānau. And being able to escalate concerns and also address the needs of everyone. How do you address the needs of people with the needs for people with visual impairment or different languages or different literacy abilities? These are definitely issues that need to be considered, and while we know are very important, we actually needed a starting point for the project.
So this is our current version of the display chart. The display charts are located in consumer rooms and in pivotal areas leading into the ward. They are A2 in size and located close enough to the consumer's bed for easy reading. Wording has been simplified, as you can see, and the pictures have been aligned with what consumers will find within the hospital, such as the nurse's uniform and the call bell. Out of working with our consumers, even the smallest issues can be resolved, such as adding a label to our consumer room phones, instructing them to dial 1 to get an outside line. Something so simple has made such a significant difference. At Southern Cross, we have no medical specialist on site after hours, so we needed to consider Workstream 1 along with Workstream 2 for the patient whānau escalation process. We historically have had a senior nurse on call after hours who can be called on to manage all emergencies, staffing and patient issues. We felt this was the most effective person for patient whānau concerns to be escalated to, but during our trial period we actually left it with the charge nurses so we could track any data that we needed to. The display charts have been up for approximately 6 months now, and up until last week we hadn't received any phone calls, so it was good timing. So the phone call we received was from a family member who was sitting at home alone. She was very concerned about her husband who'd had surgery and she hadn't heard anything. So she rang and we were able to act on her concern, find out what she needed to know and put her mind at ease. So that's very cool. Patients have been encouraged to use a phone number, particularly if they have reported any previous negative experiences.
Some examples of our patient and whānau and employee feedback are presented on this slide. The most empowering message for the work that we've been doing and the positive feedback that we've had on our work is the top.
I had a negative experience 2 years ago where I didn't feel listened to and felt very scared and very vulnerable. The person who brought me up to my room today reassured me and told me to ring the bell. You didn't have the poster here 2 years ago. It's great to see and it's put my mind at ease.
This is why we're doing what we're doing today. Sorry, going the wrong way. Apologies. So working with patients and whānau to adapt healthcare systems and meet their needs is actually critical to delivering safe healthcare. The work we've been doing so far has been identified at the New Zealand Private Surgical Hospitals Association, say that 3 times fast, at the awards, and we're proud to continue to work with our consumers and whānau to ensure ongoing high-level service delivery. This project can't be done in isolation. You need a big team around you, and we want to take the opportunity to thank the Southern Cross team that we've been working with, and particularly our consumer rep Belinda Clark, because it takes energy, it takes drive, and we need to be able to change processes and we can't do it without them.
So moving forward, we need to continue engaging with consumers and employees to link the missing jigsaw pieces together. There are many pieces we need to continue to work on, but our aim at this point is to roll out the display charts hospital-wide and provide support amongst our hospital network to improve consumer whānau care and ensure their voices are heard.
Our message to all consumers and whānau is quite simple. If you have something to tell, ring the bell. We really need to open up communication channels, educate our staff to listen to concerns and act accordingly.
And we just wanted to thank Health Quality Safety Commission for inviting us to speak today and look forward to continue to work together.
Hei aha, te mea nui o te ao. Hei tangata, hei tangata, hei tangata.